Hi, this is Shelley Kraft. We are coming to you live on SNNLive. We're at the NIBA conference in New Orleans 2012. I have Don Sapaugh, University General Health Systems, UGHS, a publicly traded company. Welcome, Don.
Thank you,
Good to
Shelley.
see you.
Great to be here. It's a wonderful conference.
Yeah, it's good to see you again.
Yeah.
So let's get right into it, because there's been some changes over the course of time, I'm sure. So bring us up to date.
University General Health System is a publicly traded company. We're an integrated, diversified, multi-specialty health delivery system that's physician-centric. We in essence, are the future of healthcare.
All right, now that was a mouthful. So for guys like me, put it in simple layman terms.
It's really simple. What we are is a healthcare ecosystem. What we have at the core is a hospital. And the hospital is a concierge-level hospital. It's first-class medicine in a five-star environment. And then we attract physicians who practice in the hospital. We then acquire ambulatory surgical centers, diagnostic imaging clinics, senior living communities, freestanding emergency rooms, and all of these then become a referral system for us. They feed our hospital with both patients and physicians. So having all of these under one umbrella allows us to reduce the cost of healthcare and yet provide this in a five-star environment.
You know, I have to laugh for a second, and I want to tell you a little story. So I'm reading a local newspaper in California about how they're converting these hospitals that have been abandoned by the healthcare system into movie sets. What a heck of a way, to utilize old leftover hospitals. So what you're doing is giving a new approach to an old method of how to take care of patients and making it more comfortable, making it less expensive, and giving them better health care, correct?
That is exactly right. Healthcare represents today about 16.2% of the gross domestic product. In 2020, it's going to represent 19.3%, regardless of what happens with healthcare reform. So what we've done is we brought the physicians in as our partners, and we brought other ancillary services under our umbrella. And by having all of those together, we're able to provide a higher quality of care in the most cost-effective, least restrictive environment, in a five-star environment. Imagine having private rooms with hardwood paneling and hardwood floors and oil paintings and flat-screen TVs at a cost less than the hospital down the street in a semi-private room.
My question is, how do you do it?
Well, it's because we own the system. It's because we own all of those referral pieces. So we've really created a healthcare ecosystem. And this healthcare ecosystem works in concert with each other, so it's seamless to the patient as they come from one ancillary service to another ancillary service, from one physician to the hospital.
Do you accept all the payers?
Absolutely. We accept all payers. Just like most hospitals, about 40% of our patients have Medicare or Medicaid. The balance are third-party payers, Blue Cross, Aetna, United, all the above.
Does what you do include emergency room?
Absolutely. We have emergency rooms. We provide just about every level of care. There are certain things that we don't do that are really left to a specialty hospital. For example, open heart surgery, long-term cancer treatment, maybe specialty women's services. So those kinds of services we just don't provide. And since we don't provide those, it reduces the cost of our care for the other services that are provided.
So where are you located?
We're headquartered in Houston, Texas. Our initial strategy is to expand within the region, and then to expand within the state, and then to begin making acquisitions nationwide. Our specific focus is that physician-centric model, having that physician as an active part of the solution for the future.
Well, I think that part of the solution is brilliant because, quite frankly, what doctors are looking at is higher cost and lower revenues.
That's exactly right. And as a publicly traded company, we're allowed to have that physician. Their interests are now mutually aligned with our interest. So together, we can focus on the reduction of the cost of health care. And by having that physician actively engaged in every facet of care is great for the patient. Imagine being able to operate, to go from an ambulatory surgical center to a diagnostic imaging clinic, to the hospital, and back to your home. Maybe it's a senior living community, and it was all under the same family umbrella, the same company. So for us, it's great. We've gone from negative $34 million in equity to positive $5 million in equity in 9 months. So we've had a $40 million turnaround. We're in the midst of a small friends and family raise. We'll have an underwritten secondary offering this summer, and then our goal is to uplist sometime towards the end of this year.
Well, what about the credit that should be given to you for doing this turnaround.
Well, I'm part of a team, and our team represents about 150 years of healthcare experience. Our chairman and CEO is a physician. He understands what it's like to be a physician. He understands what it's like to be an entrepreneur, and we have an amazing management team and a fabulous board.
Ladies and gentlemen, website for you to go visit.
ughs.net.
Ladies and gentlemen, a publicly traded company, University General Health Systems, UGHS. Thank you for coming on to SNNLive. Good to see you, Don.
Thank you, Shelley. Great to be here.